Bev's in the chair today. We're going to do a gum graft on her. But before we get into the nuances of the gum graft, let's just discuss what's going on in her mouth right now. So we can see an implant, crown, root canal that had root amputation and apicoectomy, plus another root canal that I did in the back here. So actually, out of the 3 services provided, 4 actually, everything is doing really well. So here's the implant that I just, implant crown that I just placed for her. You can see beautiful interface of the crown to the head of the implant. Here's a crown that I did for her a few years ago. This is old technology crown. Nice fit along the margin. Here's a root canal that's been done on the palatal root. We had some problems with the buccal roots, with the front roots, so we did some surgery there with the apicoectomy. That's all healing up nicely. And a successful root canal with an accessible filling in the bottom here. The only problem here is that this tooth has adult periodontitis, meaning that this area is genetically prone to have bone loss there. And that's why you see this dark circle up there. So that's a problem. The other problem is that she actually has minimal attached gingiva, and that's what she's here for today, is to do a gum graft on the side here. So if we take a look inside, here's the crown. Here's the implant crown. So there's an implant in her jaw, and the crown is successfully on there. Here's this tooth here with the crown, and you see there's been bone loss around that. We've done surgery in there. It's looking very healthy, actually. There was all pus coming out of here before, but we cleaned it up. I can't do really any better for that tooth. There's still the bone loss, but it's healthy. Before, when I used to push on the gum, there was an exudate coming out, like pus and green and yellow junk. Now that's not happening. Right together for me, Beth? Look how nice that crown looks. Now, once again, why is the color different? Because yellow and white, right? Well, I'll tell you why. Because why should I give her a yellow tooth when I can give her a white tooth? Especially that, if she ever decides to use Crest white strips, these beautifully shaped teeth that have beautiful enamel, have no fillings on them, if she does Crest white strips, she can lighten these teeth up and match that. So that's really much more pleasing. So what we're going to do the graft is, I'll show you everybody, just give me a second here, is right in this area here. I don't like the tissue right here over my implant. See this muscle tissue? This is her muscle of her lip, which is a tube that attaches right here, and it's pulled back here. So there's no attached gingiva around my implant here. So it's pretty abstract thing to talk about, a gum graft, but this is what we're going to do. We need to produce a wide band of tissue like we see here, a wide band of tissue like this pink tissue here. From the edge here we can see that it's lighter pink, it's strong, it doesn't move, and there's a whole band from edge to the top here. See that? You can follow an imaginary line from here all the way across, and then all of a sudden we don't see any of that tissue. Okay? And then it gets into this mucosa tissue. So here's this wide band of tissue. This is the muscular tissue. This is what I want to create over my implant. Here's the soft tissue here. This is called lining mucosa, see? So it can move around. But then there's a barrier of muscular gum tissue, and that's what we need to create for my implant here. So if I need to create something, I have to bring it from somewhere else. Doesn't that make sense? That means I have to, we talked about this is doing a gum graft. So where am I going to get the tissue from? Right here. I've got a beautiful pad of tissue that I can fillet off like a cheese slicer off the side here and put into this area here. So I'll make a horizontal incision. This is how I'm going to do it here. I'm going to make a horizontal incision across, up, up, lift off the tissue. I'll expose the periosteum underneath. Take off the tissue here, lay it in there, and then call it a day.